typically when you get patients after these other groups, do you find that they're more or less motivated than like patients that might come straight to you once they develop the wound?
Much less.
Less.
Because they're at this point, they're like, okay, this is not going away.
They've like accepted.
Might as well accept it. And that's why it's so hard to get them to change their behavior, because they're like, I tried it before, it didn't work, which they didn't try.
Right.
They're referring to all these years of being treated by these groups and the wound not going away. They're like, I've tried everything, it's not going away, so might as well accept it. And that's why it's so hard for me to take over after these groups. It's much easier if they come straight to me from the hospital, or, I mean, they still have chronic wounds. It's still going to be hard, but when they are treated by these groups, they've given up, essentially, the patients, because like, oh, I've been treated for years now and we've tried everything, and
Yeah, like how are you different? Like,
yeah, what are you gonna say? It's like, oh, you telling me I'm gonna lift my leg for a few hours and the wound is gonna go away after all these cleanings and dressings they've been using? That's nonsense. So they don't do it.
It's like Dorothy in The Wizard of Oz. You had the power all along.
Right.
It was on your feet.
Right. Exactly.
Yeah.
Exactly.
So do you have any tips or anything for like home health agencies or hospice agencies or whoever you work with that, can lead to better outcomes for patients?
Yeah, I mean, essentially it's up to them. I'm not going to dictate what they can do or what they should do, but I think it's better to actually leave it to the professionals, if you will, somebody who knows what they're doing, and not just these groups who can do wound care and just settle on managing it rather than healing it.
Right.
And also ruining the patient's expectations. And the mind is a very powerful thing. So also when I see patients, I tell them, you have to feel that you're getting better. Like just accepting it and thinking like, oh, I'll let you do your thing and I'll wait for it to heal. No, you have to be, you are the captain of the ship. I'm just helping. You're doing all the work. So if they've given up, that's
then it's over.
Almost like 50% failure.
Yeah.
50% of the effect of failure.
So if I was like, if I were like a home health agency and I'm just like looking for a wound care physician or, a wound professional to come evaluate the wound, do whatever, how could I differentiate between someone who's going to be good and...
Yeah. I think it's easy as far as you should look at their credentials, because as far as I know, there's only 1 or 2 MDs who actually go to patients' homes and do wound care in LA. Mm-hmm. And I'm one of them.
Nice. So it's him or it's or don't do it.
Pretty much, yeah.
Yeah. No, that's fine.
But
sometimes you could be the best, and that's fine.
Yeah. and I think also not just credentialing in terms of the degree, also the background. You could also have, there's a lot of family physicians. I'm not saying that they're not, some of them are amazing at wound care, but in order to do proper debridement, not to damage any structures, nerves, or blood vessels, or make it worse, debridement is the cleaning of the wound. Mm-hmm. You should have surgical background. You wouldn't have a family physician do a cardiac bypass, would you?
Yeah, exactly.
You should have proper training.